Hello, everyone. I'm Wendy Doyle, President and CEO of United We. Welcome to our release of our most recent research study focusing on childcare licensing in Oklahoma. Thank you all for joining today. Please save your questions as we will have time at the end for Q&A. You can certainly drop them in the chat throughout the presentation. If anyone has a note-taking bot, we are going to disable those as of today's webinar is going to be recorded, and we will provide it at a later date so you have access to the information. Advancing economic leadership for women is our North Star at United We. In order to do that, women have to work. We focus on labor force participation, which means women in the workplace or women's entrepreneurship. And if we do that, we can grow Oklahoma's state's economy. In order to do this work, we know that there are many barriers holding women back, but childcare is a significant issue facing Oklahoma and most states across the country. As many have heard or experienced, it is extremely expensive in the United States and is difficult to find oftentimes. Childcare is a crisis that keeps women and their families from advancing economically, and especially in Oklahoma. Additionally, childcare providers are struggling to stay open, meet state and federal licensing requirements, and pay a living wage. These economic barriers for childcare providers are significant as more women own childcare businesses and are childcare providers, and particularly women of color. To get a better grip of the issue, United We conducted multiple focus groups of childcare providers. We wanted to listen, we wanted to hear, and we wanted to learn. And what we learned is that childcare, primarily their business owners, and the amount of paperwork can be burdensome and can take hours of dedicated time to stay on top of. Based on what we learned from the focus groups, we knew that we could, as an organization, United We, investigate and look further into licensing regulation to better understand the barriers impacting the availability and viability of opening a childcare business. Today's research specifically focuses on reviewing licensing regulations for Oklahoma at the county and municipal levels. This study connects back to what we learned from childcare providers. There's lots of paperwork. We aim to ensure children's health and safety are at the forefront, but we believe we can identify business efficiencies in Oklahoma. We aim to ensure children's health and safety, again, are at the forefront, but we can believe we can move this forward. A big thank you to our generous investors who helped us make this research possible. The Ash Grove Charitable Foundation, George Kaiser Family Foundation, Curve Foundation Incorporated, and Oklahoma Partnership for School Readiness. Thank you for your generous support. Now, I'd like to share a little bit more about United We and introduce our guest speakers. At United We work to advance all women's economic and civic leadership to make meaningful change. We've been working for 33 years to unite people around nonpartisan policy issues to empower women and their families. It's a team effort, and we've been fortunate to have research and funding partners around the country, and particularly here in the Midwest. As a nonpartisan think and do tank, the way we advance our work for change is through a simple but elegant approach: research, solutions, results. United We works on the ground throughout the Midwest with research partners, policymakers, and elected officials to elevate the voices of women and advance these nonpartisan policies forward that we believe can serve as a model for the rest of the country. Our policy lab is an initiative born from a powerful vision for change across Oklahoma, Missouri, Kansas, and Arkansas. The lab provides actionable research, innovative solutions, and meaningful results to drive systemic progress for women throughout these states and beyond. By setting a template for nationwide change, we are paving the way toward a brighter economic and civic future for all women. As part of the policy lab, we have childcare licensing studies being released soon for Missouri on November 20th, Kansas on December 12th, and we anticipate Arkansas for next year. Oklahoma is leading the way for these conversations. In addition to today's research, in 2022, United We partnered with Oklahoma State University's Spears School of Business on the status of women in Oklahoma research. It's a report that examines women's economic status in the state and highlights areas of possible action to economically empower women and their families. I also want to briefly touch on another initiative that we've focused on, Women's Entrepreneur Childcare Project, which is an effort to generate awareness and new policy ideas to reduce the childcare barriers limiting women's entrepreneurship. As part of this project, United We commissioned a high-level review of state-by-state licensing regulations and certain aspects of their implementation in the 50 United States states, the District of Columbia, and Puerto Rico. The study examined 4 aspects of state licensing regulations, including the content of licensing regulations, licensing fees, availability of information on the licensing process, and frequency of licensing renewal and inspections. The study lifted up best practices across these 4 aspects. You can find the full report on our website and state profiles of all the states that examine how a state is doing against these best practices. Oklahoma is implementing best practices like having the home license page available in multiple languages. However, Oklahoma could benefit from renewing the inspection process, as Oklahoma is requiring inspections 3 times a year when the national average is 1. This is an area to look at, have conversation, and to identify, are there barriers here, or are we in a good place? Now, I'd like to highlight our speakers and let's get to work on our research. Participating today, first, we have Representative Suzanne Schreiber, representing the 70th District in Oklahoma of the House of Representatives. She also serves as Program Officer for the George Kaiser Family Foundation. We also have Carrie Williams, Executive Director for the Oklahoma Partnership for School Readiness Foundation, another generous funder for this research that we're so delighted to have with us today. And finally, we have Adrian Redmond Sonogo with the Oklahoma State University College of Education and Human Sciences. Adrian is the Associate Professor of Mathematics Education and Associate Dean of Academic Affairs, and was one of the lead researchers on this project. First, let's hear from Representative Schreiber. We're so appreciative of her support and dedication to childcare and advancing women's economic development. Representative Schreiber, welcome.
Thank you so much for having me. And if I'm jumping around, someone give me a hi sign, because Wendy's been freezing a little bit for me. So if it's my internet, I can just turn off my camera. Thank you again to United We for doing this research and focusing on Oklahoma. Childcare is a big, complicated issue. It's a very tightly woven basket, and you pull on strings and they touch on one another. And it's hard to unwind, but that doesn't mean that we shouldn't look at the whole basket, because it's what takes care of everyone. It's what is at the very bottom of the workforce, and you put all of the workers' kids in there, and then the workers can go to work. And that's kind of how I think about it. And the more that we share that information and help others learn and think about it like that, because for a long time in the United States, we've thought about childcare as something that was just going to happen. Families were just going to figure it out. And the modern economy doesn't really work that way anymore. Many families may have one parent, maybe a grandparent trying to take care of several people. Someone may choose, and they might need both incomes. So there's really a variety of different ways families end up needing childcare. And the state has made an agreement that we want our families that want to work to be able to work, and people that go to school to be able to go to school. And so sometimes, depending on the income of those folks or their economic level, we share in the cost of that. So the state figures out what its share of that is, and that's how important it is to our whole economy, is that the state has agreed to share in those costs. And the bottom line is, it's because the investment in early childhood, young children, and taking care of them and creating a healthy environment is the most studied and has the most benefits for long-term of anything we can think of. So there's hundreds of reasons that the states decide to invest in this, and we have to decide at what level. And we in Oklahoma have a really very bipartisan group of legislators who are starting to learn and believe and advance this. And I've been in the legislature for 2 years. I'm going to be starting my second term. And I ran a piece of legislation that cut some red tape and then some other investments in childhood to recruit and retain our early childhood workforce, and then also to incentivize our employers to share in the cost of childcare with their employees. And both of those have made it right to the precipice of getting done in my first 2 years. And we will be taking those forward again. And I feel confident that we will get them done because this is not a partisan issue. This is not an urban rural issue. This is not a red blue issue. This is a family issue. This is a workforce issue. We have incentives when we see a need for nurses, for software engineers, for aerospace. The state makes a decision to incentivize those. And we are just about to make the decision, I think, to incentivize childcare because nurses, aerospace, software engineers, none of those industries grow or thrive or do the things that they need to do without that basket at the bottom of childcare. So thank you for having me. Thank you for this research. We need to go at this basket every way and fix little parts of the weaving and I think a lot of that is going to have to do with some of the recommendations that you have. So I look forward to the discussion.
Thank you, Representative Schreiber, for your leadership, your service, for being a champion, for joining us today. Next, I'd like to invite Carrie Williams, who is a vibrant leader, who is also an investor in this research report, to share her perspective. So, Carrie, welcome.
Thank you, Wendy, and thank you for the opportunity to speak with you all today. As Oklahoma State Early Childhood Advisory Council, OPSR has long recognized that access to affordable, high-quality childcare is crucial to the well-being of our communities, our families, and especially the women of Oklahoma. When we fund research in childcare, we're not just supporting studies and reports, we're creating a pathway toward real, sustainable solutions that directly impact the lives of Oklahomans. The research conducted by United We and Oklahoma State University is not only a resource, but a bridge that allows us to look at the challenges faced by childcare providers, particularly women, who make up the vast majority of this field. And let's not forget, by strengthening childcare systems, we're supporting families across the state of Oklahoma, creating a more secure foundation for the children in our communities. One of the key insights from this research has been the identification of licensing barriers that often keep dedicated providers from meeting requirements. The barriers aren't just logistical, they have real human impacts, constraining providers, limiting family access, and hampering our ability to grow childcare infrastructure in a way that meets demand. But with funding and support, research can bring actionable solutions that simplify these barriers. By doing so, we're not only helping providers, but ensuring that parents across Oklahoma can find quality, accessible childcare without additional burdens. Moreover, the research is essential in informing and educating policymakers, community leaders, and the public. The insights gathered allow us to approach childcare challenges with a fresh perspective, rooted in data and evidence. It gives us the ability to advocate effectively, not just for change, but for specific solutions. Representative Schreiber mentioned a few that we know will work. Things like incentivizing and recruitment and retention of a quality early care workforce will be actionable solutions that we think are highlighted not only in the work of United We and Oklahoma State University, but have already made a strong impact with some COVID relief funding that the state had available. And we think with good policy solutions behind them to make them sustainable for the long term will have a long-lasting impact on our field. We can turn complex systemic issues into opportunities for positive transformation because of the research conducted by United We and Oklahoma State University. It's time to shift from viewing childcare as just a need and seeing it as a priority. When we support research that addresses barriers, we're investing in a brighter future for Oklahoma's families. So thank you again for supporting this mission. And now I'll turn things back over to Wendy, who will guide us through the next steps.
Thank you, Carrie. We're grateful for your support and your leadership. Now, we'll turn to Adrienne Redmond Sonogo, who is going to walk us through the research report, share the results. And Adrienne, we know this has been a labor of love working on this project, so we're excited for you to share the research report with us and walk us through the findings. Take it away.
Thank you, Wendy. Good morning. I'm excited to present our findings. My co-authors, Evan Davis, Carlos Valiente, and Don Murray, are unable to join us today, so I'm going to speak on all of our behalfs. Our focus is on understanding access and barriers to childcare in Oklahoma, which is critical for supporting families in the workforce. Access in Oklahoma is a challenge for families with shortages in many counties across the state and a cost that averages $11,582 per child, an amount that is 10% of married couples and 32% of single parents' incomes. Over 40,000 children in Oklahoma receive a child care subsidy. Next slide, please. This study sought to identify the main barriers to opening a licensed child care in Oklahoma, including centers and home-based daycares. We combine quantitative and qualitative data sources, gathering information from publicly available databases, including the Oklahoma's Partnership for School Readiness and the Oklahoma DHS Child Care Locator websites, municipal regulations, and focus groups with child care providers. This mixed methods approach gave us a comprehensive view of both the systemic barriers and personal experiences in obtaining child care licenses. Next slide, please. To analyze these data, we used descriptive statistics and geographic mapping and visualization with Tableau. This included frequency counts, central tendency, dispersion, correlation, and geographic dispersion. We looked at information by county and zip code, but opted for county-level data to provide a more accurate visualization. We also used thematic coding of transcripts from focus group interviews, using the participants' words as codes where appropriate. Next slide, please. Figure 1 shows the number of child care facilities by county. This ranged from 0 daycares in Cimarron County to 839 in Oklahoma County. Because the data were skewed due to a large amount of the population living in 5 counties, the shading in Figure 1 represents 4 quartiles to better group similar counties. The number of facilities is correlated to the estimated number of children in each county. This data demonstrates the concentration of licensed child care in the state. At the time of this research, there were over 3,000 licensed child care centers and home daycares in the state. Market forces are at work here. The slots tend to be near the population centers. Next slide, please. Figure 2 shows the estimated number of children 0 to 5 per licensed child care slot. Again, the shading represents quartiles. The darker shades in this figure represent large disparities between demand and supply of child care. Half of all counties in Oklahoma have more than 2 children per available licensed care slot. Many counties have even more, demonstrating the need for additional child care in the state. It appears that the state has adequate capacity. However, those open slots are not always near the families who need the care. We are seeing large numbers in our more rural counties. While acknowledging that many households have a parent at home, if every child in Oklahoma needed a potential slot, one wouldn't be available. Next slide, please. We wanted to explore the differences in municipal, city, and county regulations for zoning, health and safety, and licensing permits across Oklahoma to determine if these were barriers for those wanting to become licensed. We found a lot of variation in regulations across Oklahoma. First, access to data on requirements was difficult to obtain. With many census-designated places and unincorporated communities across Oklahoma, it was necessary to look at county regulations. We found that all home daycares and centers need to obtain a license or permit from DHS. That's no surprise. However, many towns require businesses, including home daycares, to obtain an annual business license or permit. Costs and application process for these varied by location. Zoning requirements also vary across the state. Health and safety regulations were typically aligned with DHS requirements. Next slide, please. With limited data on these processes, we felt the need to hear the voices of those who had recently gone through the process. We conducted 90-minute focus groups with 12 licensees in Oklahoma about their experiences. We used focus groups so that the participants could compare and contrast their experiences and build upon each other's stories. We developed themes from these focus groups that are intertwined and inextricable. Next slide, please. Our first theme was centered around DHS staff shortages and high turnover. Participants felt that this hindered all aspects of the licensing process. It led to delays and confusion. Some mentioned that they didn't know who their worker was because they had changed so many times. One participant stated, "I don't even know if I could count on both hands the amount of workers that have rotated through these doors. It is hard to keep up on who my person is." Rule enforcement also varied by worker. One participant stated, "I was being pushed to different workers. Someone would contact me, give me some information, we would talk about something, I would make a change, and then I would be informed by another worker that this is not what they needed." They also expressed a frustration with the lack of ownership. They wanted more proactive help and guidance to navigate the process. They really wanted someone to figure out why workers didn't stay long and to fix that. Next slide, please. Participants also wanted DHS processes and communications to be clearer, more accessible, and more proactive. The guidebook was mentioned by several participants as the primary means of communication. Some felt it helpful, while others felt overwhelmed by its complexity. They wanted a holistic process, including checklists and coaching. Many described a challenge with waiting weeks for the responses to emails. Next slide, please. The last theme centered around the desire for continued incentives and improved efficiencies. Most felt the COVID grants were extremely helpful. They wanted efficient background checks for employees, as this kept them from being able to hire good workers quickly. One participant mentioned waiting months for a potential employee to have their background processed, and by that time, the employee had moved on to another opportunity. The fire inspection process was also referred to as a nightmare. Smaller communities often struggled with getting the right person out to do a fire inspection. One participant was even still waiting to get the fire inspection approved at the time of the writing of this study. The other challenges was the DHS STAR system and the need for curriculum to be listed on every activity. Some felt it took away from their ability to offer high-quality care. Another participant mentioned the need to hire an actual curriculum specialist just to write the standards on activities so they could maintain their STAR level. Lastly, they wanted to ease staff training and early learning guidelines requirements. Next slide, please. We offer several recommendations based upon these findings. First, we need to increase childcare capacity in the state. While the Department of Human Services does an amazing job of providing support to workers and families around the state, workforce stability was an issue. Streamlining the licensing processes and reevaluating regulatory requirements would be helpful. Reducing the variability in municipal, city, and county regulations for zoning, health, and safety, and permits would be helpful to those going through the licensing process. At least having those available on a central website would be very helpful. Lastly, we can't state enough how valuable the participants felt the financial support and incentives were. Continuing these incentives has the potential to increase capacity and quality of care. One limitation of this study was that we did not have an opportunity to talk with DHS caseworkers and managers to gain their perspectives on these issues. We feel their voices are critical to developing a comprehensive understanding of the problem and can help to find workable solutions. We plan to listen to their concerns in the next phase of this research. In conclusion, addressing the childcare barriers in Oklahoma requires a collaborative effort across state and local governments, Department of Human Services, and childcare providers. By increasing capacity, stabilizing support, and streamlining processes, we can enhance access to quality childcare and ultimately support Oklahoma's families and the economy. Thank you for your time, and I'm happy to answer any questions that you have. Wendy, back to you.
Thank you, Adrienne. Very insightful report. This report, we hope will, we have the research and the data that now can lead to communication and identify some solutions, and we can get results for women in Oklahoma and advance Oklahoma's state economy forward. Of course, as Representative Schreiber stated, and also Carrie Williams stated, there is no magic wand. This is not an easy solution or a one-stop solution. It takes multiple approaches to the childcare challenge. And what we presented today is just a small piece of the big puzzle of childcare. We hope that this research report can be shared and utilized with elected officials, local business and community leaders, and that in positions of power can help influence and advance changes and the economy forward in the state of Oklahoma. So again, the full report is accessible on United We's website at united-we.org. And we look forward to continued conversations and partnerships to make this reality and really look at what we can do in the state of Oklahoma to reduce the red tape, the paperwork, and really focus on what's most important is the health and safety of our children in Oklahoma. So with that, we're going to open it up to questions. And if you have a question, feel comfortable in dropping it in the chat. We have just a couple of minutes. We have a question from Joni Wickham. Was there anything that these findings that particularly surprised you? And I'll just give each one of you an opportunity to answer that. I'll start with Representative Schreiber.
I didn't see a lot of surprises just because I've been working in this area, but I was wondering how we could, without having to pass any new policy, help DHS connect with providers better and help them through the process, because that is a well-staffed agency. And so how do we make sure that they have more stability in their licensing advisor? That was kind of surprising to me that felt so bumpy to providers.
Great. And Carrie.
I would say not any real surprises, because like Representative Schreiber, this is a space that we live in. But I do think there's a real misnomer, even when we're talking about childcare access in terms of licensed spaces available. And those slides they're really important slides. They show actually that Oklahoma has increased access to the capacity from a licensing standpoint of childcare that's available. But I think what we're missing is the evidence that these programs, these providers are not actually operating at their capacity. So you hear a lot that childcare programs have 2-year wait lists, especially for infant and toddler spaces. But they're not operating at 100% capacity. They're operating at about 85% capacity, and it really is a workforce issue. And some of these licensing barriers are the reasons for the workforce shortages that we have. And so while not surprising, I think it is a kind of a good next step is to start looking at how do we support increased capacity within the programs that are already operating.
Thank you, Carrie. And Adrienne.
I think for me, the thing that surprised me the most was the difficulty of obtaining reliable information on local regulations. That was really surprising to me. I just figured it would be easy to go find them. We had to call people. We had to look on the web. It was pretty challenging. I also felt that the fire marshal challenge, getting access to fire marshal inspections and knowing who to call was really surprising. And last but not least, the delays in processing background checks really surprised me, because if we don't have people that we can get into these empty positions across the state, we may open up a childcare facility, but if we can't get qualified people to come in and work, then that impacts capacity as well.
There's another question in the chat. I'll direct this to you, Adrienne. Do you have any idea of the number of home-based, non-licensed providers in Oklahoma? And is that allowed? And Carrie's shaking her head. So Carrie, feel free to jump in too.
So we don't have a grasp on unlicensed programs in the state of Oklahoma. I can tell you that we have, as of June 30th, which is when we do our kind of annual point in time survey of the number of licensed programs in the state. We have 3,108 licensed facilities in the state of Oklahoma. 1,525 of those are child care centers. 1,583 are family child care homes. And so the overall license capacity in the state of Oklahoma is a little over 127,000. But when you compare that to the need, we're well short. When you are looking at the same demographics of number of children who have working parents and need care of some time, that's about a little over 50,000 slot deficit in license capacity. And that's not taking into account, again, the programs that are operating at about 85% of capacity. So the deficit is still really large.
Thank you. Anything else to add, Adrian?
We did hear from participants that they were frustrated by the number of unlicensed facilities in their communities. And they also mentioned that they felt that these COVID, the former COVID incentives actually brought some of those people out and became licensed. And they felt that that was a continued incentive for obtaining licensure.
Thank you. And a question from Joanne, were demographics done in the study? And Adrian, I'll turn to you.
We do have the demographics and they should be listed in the report.
Okay, thank you. Thank you. So you can access the demographic information in the research report on our website at united-we.org. And Representative Schreiber, Catherine would like to know the bill numbers, the bill numbers that you referenced on the child care legislation.
So for the previous legislative session, we ran House Bill 1808. That was the recruitment and retention incentive for early childhood licensed workers that would have provided them with childcare eligibility, free childcare eligibility. And then 4751, I think, was the tax credit bill. But if you'd like to reach out to me, I'm happy to follow up with you with more detail on any of those.
Thank you. And another question for you, Representative Schreiber, from Rebecca. What policies are in place or planned to address the licensing process? How do variations in municipal and state policies affect licensing requirements? What can the state do to improve outcomes?
So we are specifically looking at some of the intersection between local communities and fire regulations and the DHS regulations. When we as a matter of policy, we always want to help communities maintain local control and not be regulating that from the state. So we have to figure out what that blend is by giving these small businesses the notice, transparency, security that they need to open and start a business and operate. And we never want to compromise quality, but when we overlay regulations that apply to all small businesses and don't take into account that DHS heavily regulates childcare already, some of those things are burdensome. And so looking at that intersection, I think, is really important while also maintaining local control in terms of zoning for communities so that they know what they need in terms of those things. But in my first year, we did change a requirement that allowed for small home daycares to have the ability to use their DHS licensing for how many children they would have at the home and not be limited by that by local communities. So we're balancing what is safety, what does this specific business need, with really broad regulations for every kind of business. And I think childcare we need to recognize that it is very much heavily regulated by DHS already. And so what can a local community be alleviated of?
Great, thank you, Representative Schreiber. The chat is very active from, lots of questions. We're not going to have a chance to get to all of them, but, just a point too of that childcare should be, treated more as a small business, industry that, entrepreneurship, women-led work, women-owned businesses. So just kind of reframing how we're talking about the childcare. There's lots of discussion about that. The next question I'll direct to Adrian is from Sarah. Does the research report include tribal childcare? I am surprised by seeing the high number of children per slot in Cherokee County.
We chose the numbers based upon those who have from the Child Care Aware website. So if they are a licensed child care facility, we scrubbed that website and pulled all the data from there. So if they're licensed, then it's included in the data. Carrie, you may have some further information on that.
Yes, Carrie.
I was just going to put in here that I'm going to pop into the chat the link to the childcare portfolio, which OPSR pulls together every year. We work with Childcare Aware of America and Oklahoma Department of Human Services to pull this information together. And it will give you a county profile by county. You can look at the state as a whole, but you can also look at individual county in terms of access, cost, and availability. So I'm going to put that in the chat.
Thank you, Carrie. We are running up short on time. And for those questions that we didn't get answered in the chat, please feel comfortable in reaching out to any of us who are on this webinar, on our panel today. We are happy to continue the conversation. We want to thank you again for joining us today. I'd like to give a special thank you to Representative Schreiber, Carrie, and Adrienne for being a part of this conversation, for your leadership. There's lots of work to do. We want to continue the conversation, make sure we put action behind this research report. And again, you can access it on our website at united-we.org. Thank you again for joining us today, and we hope you have a great day.